Take a deep breath, take the higher road. That's what they always say, as if they know the way. They won't take it from me. But don't ever doubt yourself, 'cause life ain't just a dream. You made your own, so kick and scream. The people will act with a never-ending force. You never had the chance, so what you waiting for? The day has come, my friend, 'cause this is war. It's time and this is war.
There comes a time when silence is no longer an option. When the pain becomes too loud, too real, too devastating to keep hidden in the shadows. We are living in the aftermath of medical betrayal, of protocols that killed, of mandates that maimed, of systems that silenced not just patients, but their families, their advocates, and even their nurses. And now those voices are rising. The vaccine injured, the families of the ventilated, the caregivers who tried to sound the alarm and were dismissed as fringe. We are done being dismissed. This is no longer about medicine. This is about morality. This is about justice. And it is about the undeniable collective cry for accountability from those who suffered most. We're not conspiracy theorists. We are survivors. We are not anti-everything. We are pro-truth. And we are coming together from every background, from every belief system to say no more. No more lives lost to protocol. No more silence in the face of institutional harm. No more pretending that this didn't happen. There is power in our unity. There is healing in our voices. And there is unstoppable momentum in the truth. This is the movement. This is the Andy effect. And we're just getting started. You're listening to Nurses Out Loud on America Out Loud Talk Radio. I'm your host, Nurse Kimberly Overton. Before we get started today, I do want to encourage our listeners, if you have questions or comments, or perhaps you want to share your own experiences with what you're seeing on the front lines of healthcare, you can now submit those to us directly by visiting our website at nursesoutloud.com. We would love to hear from you. We encourage all of you to engage in the battle and find your voice in this fight. But until you are able to do that, we will continue to be that voice for you. Today's episode is not easy, but it is necessary. We're talking about a man named Andy, a son, a father, a brother, a fighter, and the devastating way in which his life was taken, not by a virus, but by a system that failed him in every possible way. Joining me is Ellie Hodge-Hayes, Andy's sister and fiercest advocate, who has carried this story with both heartbreak and boldness. Together, we'll unpack the truth of what really happened, how Andy was isolated, mislabeled, denied appropriate care, and ultimately declared brain dead while still under paralytic medication. This is about more than one man. This is about the Andy effect, a ripple of impact, truth, and advocacy that refuses to be silenced. Ellie, thank you for being here.
Hi, thank you very, very much for having me. It's my pleasure to be here.
You're so welcome. You know, Ellie, before we dive into what happened, I really want our audience to know who Andy really was. So if you would just please take a little bit and just briefly share about his personality, his family, his values, what he stood for, and his love for life. What made him special? And what made him Andy?
Well, there's several things that made Andy Andy. Sorry, just one second.
You're okay.
This has been a long time coming.
You take your time. You're fine.
So Andy was my little brother. We were 2 years apart. I I don't ever remember him not being with us. Even once we were married, his first marriage, it she was related to my husband, and so we were always still at those family functions, and then our family functions, and then they divorced, and he and his kids they moved up with in with us. Um, but when he was little, like he could light up any room, and that carried with him as he got older. He was funny, protective, and stubborn in all the right ways. He was a plumber by trade, but a deep protector in many ways that I didn't even see until after he was gone. And he was the kind of man who he didn't just show up. He stood up. He would tell me if I was right. He would tell me if I was wrong or anybody. He didn't care what you thought about him, but he didn't like you to talk about other people or to do other people wrong. He just I don't know, he wasn't just my brother. He was like he's supposed to be the third parent in our home, and it's like I'm raising the whole crew. And I got my husband and my brother, and they had two dads, yet Andy got to always be the fun kind of parent, I guess you would say, to all of our kids. We raised them together as siblings, and they lived with us for the past 12 years. So he just had a fire in him. He knew what mattered. He had already faced more pain than most do in a lifetime. And he still found a way to make people laugh at the end of the day. He still had hope, even in the hospital, drugged and broken. And he kept fighting until they took over his narrative. They didn't just take his life; they stole his chance to finish his own story. 100%. He didn't get to do the narrative that should have been Andy. But that's what I'm here for, because he did have one voice in those records that he chose, and that was me. And so that's what I'm going to do. I'm going to do what he wanted me to do, and that's tell his story.
Amen. I really think it's important that we begin there, that we don't start with the trauma, but that we start with the humanity of the story and the human side of that. Andy was a person, and I really wanted my listeners to be able to connect with and understand who he was before we really dig deep into what happened to him, because Andy's not defined by what happened to him, not at all. Um, but what happened to him is a tragedy, and it's one that needs to be shared and people need to be aware of. So let's talk a little bit about what happened. If you want to just kind of start by walking us through the sequence of events that led up to Andy going into the hospital and how those things started to unravel.
He had broke his leg at work one day, a really bad break. He had went to have it's surgery, a surgical procedure done on it at U of L Hospital. Everything we thought went okay. They kept him in the hospital, like he was in the hospital for a full week. Blood thinners, antibiotics. They really, really watched his leg. His doctor had told him, when you leave, make sure that you pay attention to this and this and this. He named several things, and even sent him home with the paper. Um, that was August. Come October, the screws from that procedure, they began to back out of Andy's ankle. And so he had to go back, and they told him that he would need uh, another procedure done, a complete ORIF. Refix is what they called it. And so that's kind of when things began to get weird. Like, I don't think I noticed it then, but that was in October, and his surgery wasn't until December. And it was all because COVID, the protocols had began in the hospitals, had started to cut back on those same day surgeries and this and that. Finally, he gets through to them. They schedule his surgery in December. And after that surgery, he just never was the same. And he began having breathing issues, which we know it was sepsis. He went to the hospital twice in January until February. he was released back to work because they were trying to shoo him in, get him in and out, COVID masks. We can't do this, we can't do that, 6 foot apart. So they weren't even checking him really, but they released him back to work. And then it was 2 weeks later, after he was released back to work, that his breathing began to labor, I guess you would say. And until I guess it was the 10th, I told him, you've got to go to the hospital. When we dropped him off, they told us that there was nothing that we could do there, that they would call us when he was ready to be picked up. And we left, and he went in on crutches. And that's where everything just began to crumble. He told him when he first got there, my leg hurts. And I know that he would have been having trouble breathing due to it was 40% room oxygen level, I think, from the oximeter. If I said that right, I may not have. But they didn't ever note that his leg hurt at that moment. In fact, the text to me with a picture of his leg, it was the big nice nurse said, we're not worried about your leg right now. We're worried about saving your life. And unfortunately, that became not what they did, because that hospital then transferred him to a sister facility a few days later. And that sister facility never even received his medical records. That sister facility, if you want to call it a facility, I don't know what they were doing. I don't know how we get to where we're at, but I will tell you this. We were negative COVID from October, because you had to be tested to get into the doctors, all the way to when he went into the hospital, even negative when he was admitted into that first hospital. But they got him to, I'm just going to have to say Owensboro. They got him to that hospital, and immediately before the test was even done, he was COVID, according to the timestamps.
Right. So he was struggling with his breathing leading up to this, which is why they suspected that he may potentially have COVID. He had tested negative.
The original hospital didn't. They suspected that it was a bone infection. They got sepsis in the records, and that's why they transferred him. He needed a bronchoscope, and they didn't do it at their hospital. So the doctor said, we're going to need a higher level of care. And we had a pulmonologist at another facility in Louisville, Norton's. And that's where we were scheduled to go. That's where the medical records say that he was going to go at first, was Norton's. And then he calls me while he's getting ready to be transferred, telling me that he has to go to Owensboro or he's going to die. And I said to him, no, you're going to Norton's. And he said, no, I have to go to Owensboro. We were on a video call. And he said, I've got to go. He said, I need to finish packing my stuff before we leave. So he was good enough, healthy enough to pack his own bags. Yet the consent form was a verbal consent. He never signed it. When he got to Owensboro, when I talked to them on the 17th, even though they denied talking to me, they told me, no news is good news. So just go with that. And at first we did. We weren't having to call them because we were calling him on his phone. Yeah. So I didn't have any reason to have to call the nurses. He told us that he had COVID, not them. In fact, not even the health department. They tried to reach him at Owensboro, and Owensboro told him 3 different times that he wasn't there. So it's almost like he was already erased from the minute that he arrived.
Right.
And I guess that's when you can say things began to unravel, because everything just kept going down from there.
So the bone infection that he had, I'm assuming like an osteomyelitis.
Mm-hmm.
Did they give him an antibiotic treatment for the bone infection?
They absolutely did it at Owensboro Twin Lakes Regional Medical Center in Litchfield. He had been on a course for 4 or 5 days of, I think it was azithromycin, maybe. And he was on a steroid as well. And he was getting better. Like, we've seen improvements. I actually got to go in on the 14th. I saw him. I drank after him, because I even asked him, well, you don't have the corona, do you? And he was like, no, they tested me. I don't. And we just sat down and that day had a really good visit for a few minutes. He was hungry. He didn't want to eat their food though. He wanted me to go and get him something and then sneak into the hospital back to him. And I'm like, no, we're not doing that. I said, I'll get it for you when we leave when you get to leave in a few days. So I don't know. It's crazy. He did not have COVID. He did not. None of us caught it. I didn't catch it. I was there on the 14th of that month. And then 2 days later, he's told he's going to have to go to Owensboro to die. He gets to Owensboro, and as they bring him in as COVID, that doctor says that he doesn't see any evidence of super infection. Therefore, he's going to de-escalate the antibiotics, and he's going to they won't need a bronchoscope either. So he went there for that, and his antibiotics got stopped, and then they started him on the remdesivir, and he did not get the bronchoscope, which would have ultimately probably proved what he did have. All the
And
while,
so they gave him remdesivir,
Mhm.
which is a medication, an antiviral medication, which I'm sure everybody that listens to my show knows about by now because I speak about it incessantly. An antiviral medication that relies on viral replication in order to be effective. At this point, we don't even think he has COVID, yet they're starting this protocol. What's interesting about this, because when I was an ICU nurse at the height of COVID, everything that came in the door became COVID. I don't care what they came in with. They were leaving as COVID patients. And they were getting started on the remdesivir. Do you happen to know? I'm assuming that this was at the time where remdesivir was under an emergency use authorization. Is that correct?
Yes, it was. It was. So it was that the FDA had not really approved it yet, but I guess they had did like this emergency approval, and that's when the protocols, because I remember it clearly, the new administration had come on, and then I remember thinking, oh my, how are they going to handle this? Just stepping in, and they handled it completely awful. They set these protocols up to where we couldn't be there. Um, they it was it was almost like a Holocaust. It was almost like I don't know. I'm not a conspiracy theorist, or wasn't at that point. I didn't listen to my husband at first. He's telling me the whole time, Ellie, we got to figure this. They're up to something, and I'm just telling him to hush. Just help me figure out how to save Andy, not the world. Just I don't believe in that stuff, but I absolutely do now. Like I see hindsight. I can go back with everything, and I see that it clearly was that. I mean, he was murdered with this medication and those protocols and the isolation, failure to
Yeah,
thrive.
that's where it started, with the isolation, the sedation, the intubation, all of it. So at what point did they end up intubating him?
So the medical records note on the 19th that he possibly would need ventilation. Um, but on the 20th of February, he had gotten better, they said, and they had moved him from the COVID CCU to the COVID med floor because that's where they go when they're better, and they, I guess, their oxygen's doing better. I didn't know a lot about it because us as Americans, we weren't told about these protocols. None of us. We didn't. We just assumed they went and they were trying to save them. Um, so he's moved. I had started a Facebook visitation location station, is what we called it, to where all of his friends could pop in at any time, like it was a visit, so that he wouldn't have that depression and all those issues of not having us there because he's used to us being everywhere he is.
Yeah.
Um, it we all had a video chat on the 20th. It was about an hour long at 7 o'clock. They moved him into his room at 6. So an hour after that, we chatted with him for about an hour. At about 10 o'clock, I told him, we're going to put our phones away, Andy. You need to go to bed. It's been a long week, and you're finally getting better. You need rest. I remember him rubbing his temple, and he didn't say he felt bad. He just said, I'm tired, but I can't sleep, and I have an awful headache. And all I needed to say was, well, you have COVID. So if you have COVID plus this osteomyelitis, you're going to feel bad. So that's why you need the rest. And I told him I was putting my phone away, and I did, because I knew if I hadn't have, I would have had it out talking to him all the night. But when I got up the next morning is when they started. We had gotten a phone call from Andy, a video call. He had told us that, and this was his specific words, he looked really tired and wore out, completely opposite from when I had just went to bed at 10, and this was just 8 the next morning. He said, they think I had a stroke, but they don't think I had a stroke. He didn't seem like he had a stroke because he was still being able to use his phone. We spoke to him all day, and it was video. He video called us all day. I think in his mind, he kind of had an idea of what was going on. So I don't know. My thing was, well, let's just go with the day and see how he does with the phone. If he can work it out, let's make sure that if it is a stroke, that it's not going to get worse, or he's not going to have another one. So we did. We talked to him on a video all day. And at some of those points where we would get disconnected, he would even know to call us back. But when I spoke to the nurse and he's telling me about this bad stroke, I get my phone out and I look, and at 10:37, so 37 minutes after I told him to put the phone away, he had sent me a picture. And in that picture, it was a weird filter, which I didn't get at that point. And his lip was sagging on the right side. So at 10:37, I know that he had already began having a stroke, if that's what he was having. And they didn't diagnose it till 1 a.m., 1:27 a.m. in the medical records. He was trying to get them to come in there, and they didn't until then. Then they did the MRT, called the MRT, whatever that is. And um, he was good till about that night. And then the next morning, I wake up on the 22nd, and they had ventilated him. Um, that's we
So,
will
so
not.
there was nothing really leading up as far as like as far as you could tell is that he was not in any type of respiratory distress. It sounds like he may have had a stroke, um, or a TIA, either one.
It was
But what's disturbing to
sorry.
me
Go
is
ahead.
that no, you're fine. What's disturbing to me is that you're seeing this at 10 p.m. and then they don't find evidence or of a stroke until 1 a.m., which begs
Hmm.
the question is why are they not checking? We're supposed to check on our patients every 2 hours or every 4 hours. Usually it's every two, whether you have a tech or an aide going in and then your nurse going in at least every 4 hours. Two, if you're in an ICU or a high acuity unit like that. So he had already been on the remdesivir at this point, I'm guessing, which in my
Yes.
mind could have been what led to a stroke because we saw that very frequently, with the use of the remdesivir. Do you know how many days he was on that before this
Yes.
happened?
He began the remdesivir on the 18th, and he had it the 18th. The night he had it all the way to the 23rd.
Okay. And yeah, it's typically a 5-day course, of the remdesivir. And we did see many of our patients end up having strokes or blood clots or multi-organ failure is a lot of what we would see. Um, so that's disturbing. That's just one piece of the puzzle that's disturbing is how that his last known normal, and then they didn't recognize what was going on with him for many hours later, and that takes him out of the window for the clot busting medication that we use when we suspect a stroke, right? So I'm assuming he didn't get anything like that.
Yes, he did, but it was way late. He didn't get it until 3:27 a.m.
Yeah, I'm surprised they even gave it at that point because of the window. Is usually he would have been well past it by that point. That's a lot. It's a lot, and it's a lot to absorb. But you have, my understanding is you have medical records that proved that he actually did not have COVID. Is that right?
Right, I do. The tests in the records all show negative. Like when they submit the testing back, it's negative, negative.
Yeah.
As on the 22nd, or the 23rd, they wanted to do a convalescent plasma. Um, we said, okay, of course, we didn't know, we were just trying to save him. And with that in the records, when they're telling about the convalescent plasma, it says COVID antibody negative convalescent plasma needed. And that was the same day also that I had begun questioning, I want to see a COVID test. Um, I didn't know what else to do. We were at to where he was now ventilated. They're telling me that there's a 50-50 chance that he won't make it. He's probably not going to, is their exact words. He's going to bleed out. He's hemorrhaging, but the records say there's no hemorrhage anywhere. So everything was so contradicting. It was like completely every piece of paper in these records are contradicting to the page before. None of them tell the same story.
And unfortunately, that doesn't surprise me. But you had shared with me, Ellie, something really powerful. And that was that you told me, Andy said to you, they're going to kill me in here. What was that moment like for you when you heard that?
I told him to quit being dramatic. I told him that no, they're not. Just like I was telling Kevin, they're not. Andy, this is all new to them too. They're trying to help the best way that they can. I didn't believe. I, I hope that's not what he thought. I thought he just felt so bad that that's the way that he was really thinking. But like I said, now we're in hindsight, and I'm thinking back, and I don't know what he heard, but he heard something we didn't, evidently. It's the only thing I can come up with.
And
But like
it's almost too crazy to believe. I mean, I felt like that even when I was in the hospital and I was questioning, a lot of these protocols, but I'm like, this almost seems intentional, but then it just on its face seems so insane to even say out loud, like, oh no, there can't be this huge conspiracy where, hospital systems are murdering patients for profit. It sounds absolutely insane, right? So we are like, no, that can't be happening. And we even question our own gut instincts when we are feeling that. So if you're holding on to something like that, Ellie, like you're holding on to guilt, I need you to let that go. Let that go. All
my
of us,
guilt is
all of us.
my guilt comes from a separate promise that I had to make him. I will say the day before he got vented, we talked to Nurse Evan again, and Evan actually went into the room with Andy. A lot of the visits I found out were just like a through the window or a telehealth kind of thing, but Evan was in there. He was explaining to me before he went in what to be prepared for. He's a very sick man. He said, and the reason I say it the way that I say it that way is because I've heard that exact script. I've heard that exact in quotations from
Yeah.
another person that died of COVID. Multiple people. It was almost scripted for television. If you want to be honest. So Evan tells us. Andy asks specifically, okay, well if I have to do this, well, how do I? Who knows and says when I wake up? And Evan assures him, well, you get to decide that because you're here, you're in your right mind, you can speak. And he told him specifically, okay, my sister, she will. And he said, Ellie, because we were on a speaker. And I said, what? And he said, it has to be you. And I said, Andy, we just don't even need to talk about this. I'm not. He said, it has to be. He said, because if for some reason something happens and I don't make it. He said, Dad can't get the call. He said, Dad, you're gonna already be a nut. If something happens to me and he goes and then it'll kill Dad. He said, and then you'll have both of us gone. And I don't want that for you. And I told him, I said, well, look, you're gonna do your part and I'll do my part. I said, you show me you're there, breathe on your own some, and always let me know you're there. And I promise I will not unplug you. But I said, if it's going to help you, you have to do it. And I said, it's going to be like a sleep for you. You're going to go to sleep and wake up just like it's the nighttime. I feel like if I wouldn't have talked him into the ventilator, he wouldn't, he wouldn't have, he wouldn't have went on it because he didn't want to.
But
But I just thought that's what he needed.
right, exactly. You thought that's what you needed because you were trusting a system that we should have been able to trust. Don't hold on to that guilt, Ellie. You were doing everything that you thought that you could for your brother. And you trusted. Unfortunately, the system is broken. But I feel like, as a nurse, I cannot overstate how disturbing it is, because I feel like he was aware, like he knew something was wrong. And unfortunately, his instincts were tragically right. But, we can't live with the guilt, because the guilt is not for you to carry. You did everything right, Ellie. You did everything right. We're up against a break. We're going to come back and we're going to dig a little bit into this story, a little bit deeper into the story, because as tragic as it is up to this moment, it gets even worse. America Out Loud Talk Radio plays on the iHeartRadio network. You can also listen on our media player from any web browser, anywhere in the world. We have the best in-class apps available on Apple, Android, or Alexa 24/7. Great talk radio. All of our shows go to podcast the following day. You can hear them on apps such as Spotify, Stitcher, Pandora, iHeart Podcasts, and many more. Be sure to subscribe and rate the show on Apple Podcasts for me. Don't forget to check out our online store at americaoutloud.shop, where you can find all of the products that we represent on our network at a discounted rate, including an incredible line of products from Chemical Free Body. Unlike the majority of supplements you'll find on the market today, with Chemical Free Body, you won't have to worry about harmful ingredients, binders, fillers, or flow agents. Their ultra-safe breakthrough nano-silver technology destroys pathogens, balances the microbiome, and boosts immunity. All of these products are proudly made in the USA and are backed by an unheard of double your money back guarantee. I've made a twice daily green 85 drink part of my routine, which has led to a decrease in belly bloat and an increase in my energy throughout the day. Use promo code OUTLOUD to save 20% off the Healthy Gut Bundle. I'll catch you on the other side of this break. Stay with us.
Health insurance premiums have skyrocketed 47%. Are you optimizing your healthcare spending or paying for outdated sick care? The Wellness Company offers a better way. For $100 per month, One Wellness Elite membership includes 2 free nutraceuticals, free prescriptions on 800 plus meds, free 24/7 telemedicine, and 15% off supplements. America Out Loud listeners get an exclusive 20% discount. Go to twc.health/outloud. Use the code OUTLOUD.
Virus protection and immune boosting just got easier. Enter the Daily V-Stack. Using cellular absorption technology, we put vitamins A, C, D, zinc, and quercetin together with a multi-mineral complex for complete protection. The Daily V-Stack is basically an oral IV of 6 products, all in one, at an affordable price. Go to chemicalfreebody.com/outloud, get the Daily V-Stack, protect yourself, boost your immune system, and save 20% on your first order.
Prepare for the next pandemic with the Wellness Company's Contagion Emergency Kit, designed by Dr. Peter McCullough. Get life-saving medications like ivermectin and hydroxychloroquine, plus a free nebulizer and a guidebook for safe use. Order now by going to twc.health/outloud and use code OUTLOUD for $65 off your first order plus free shipping.
Only when the government bows to the people will America become great again. This is Malcolm Out Loud here. Join me in pushing back against censorship, my fellow Americans. Right at the top of AmericaOutloud.news are the words: many voices, one freedom, united in the First Amendment. Now is our time, my fellow Americans. AmericaOutloud.news. Liberty and justice for all.
Welcome back to Nurses Out Loud on America Out Loud Talk Radio. I'm your host, Nurse Kimberly Overton. Wherever you're listening from today and whatever you're doing, I thank you for giving me the gift of your time. Be sure to make AmericaOutloud.news your daily stop for all the latest news and happenings. We all must do our part and share the stories, the articles, the podcasts, and videos so we can help secure America's future. If you're just joining us, I've been talking with Ellie Hodge Hayes, sister of Andy Hodge and warrior for truth. Let's jump right back in. Ellie, thank you again for being here with me. I know this is difficult to relive and to talk about, but it is so important that we share this information.
I agree, 100%. When you when I seen your post about you and I read a quote that you had quoted about a tear
Yeah.
down a lady's face, her cheek,
Yep.
that really hit right in the gut. And I like saw Andy there on a vent. I see that a lot. It's just hard. But it does feel good to get to talk about it to someone who understands.
Yes, it can be like speaking about it, talking about it. It's very cathartic. It's very healing when we are able to share our stories and experiences and understand that, we are not alone. I'm not alone in this fight, and neither are you. And together we have a very, very strong and powerful voice to reach others because there are still so many people out there, Ellie, who are not awake and aware of the dangers that come with just simply trusting this medical system, trusting the way.
Absolutely. I agree
It's
100%. I've actually had some really ugly comments and messages, and that's okay because I've had numerous more good ones thanking me for speaking out and for being brave and,
yeah,
being Andy's voice. Those messages are the ones that help me to go. They help me to keep on. There'll be days that I want to just throw the records. I try to not look at them all day, every day anymore. I look at them at least once a day, go through something. Um, Except for holidays. I didn't yesterday for Easter, but yeah, it's like when I open them, I find something different. And so now that I'm able to understand them a little better, it's like instead of reading a Spanish book, I'm actually seeing, his life right there when they're telling me that it isn't. You know, it's there. He's got breath. He's got heartbeat. It's not even the same. It fluctuates. He hears me over
yeah.
the phone. So I have no way now of knowing if I can ever trust a doctor, unfortunately, at this point. Again, because Kentucky has been the first state to decriminalize medical error since March of last year, and they don't have any reason to save us now. They saw how easy it was, in my
Yeah.
opinion, during COVID.
Oh, absolutely, absolutely. Because everybody, the shield of liability was so broad, and it protected everybody. It protected the pharmaceutical companies. It protected the government officials, and it protected doctors and nurses and pharmacists. Everybody had a shield of protection except for the patients.
Right. And now our medical doctors have it nonstop because Kentucky has decriminalized medical error.
That's a whole other show we're going to have to cover.
Absolutely.
May have you come back and we might actually just touch on that. I may reach out to some of the Kentucky legislators and try to get a good interview. And that's a really good topic to cover because once they do it in one state, they are going to attempt to do it in others.
Right.
So we need to stay ahead of that curve. We need to stay ahead of that and pay attention. That's why I cannot stress enough. Pay attention to what is happening at the local level and at your state legislature, not just national politics. You've got to pay attention to what is going on in your home state. I do, Ellie, want to fast forward just a little bit.
Okay.
We left off, we were talking about he was on the ventilator.
Yes.
At some point, they declared Andy as being brain dead.
Yes. Um, that they began telling me he was brain dead on the 23rd, the late day, of course. It was be his last treatment of the remdesivir. They didn't tell me anything like that until the last dose was administered to him. Then after that last dose, he became, I guess, their profit had been the only thing they had left to do to get a profit was have another COVID patient die of COVID. So they kept telling me that he's brain dead. He's brain dead. This was on the 26th. I asked them for an EEG. They told me that they didn't do EEGs there. Um, I said, well, what do you
What are
mean?
you basing?
Every
What are
hospital.
they basing the brain death
So
on?
the brain death was done by a bedside test that the doctor did. Dr. Fraser, I'm pretty sure is what his name is, how you say it, anyways. He did a bedside test, but that bedside test, he has even got noted. This test cannot be used to deem brain death due to patient is on a paralytic.
Can I
That's
ask
what
you a
they
question? Was it called a Glasgow coma scale? A GCS? Was that what they were
um
using?
he did a stimulation
A s-
test, he said.
Okay. Okay.
Um
I know exactly what they're talking about. It's almost like a little, like if you're ever familiar with like a TENS unit, when they're trying to
Mhm.
wake you up from anesthesia, they'll do things like that. But let's talk about this for a minute because this is really, really important to know. So you're telling me Andy was still on paralytics, and the doctor admitted
Mhm.
he was still on paralytics.
In the records, yes.
So he was declared. This is very important for my listeners to listen to. He was declared brain dead while still under sedation and paralytics. Right.
For a
I
few minutes, he
really
was until I got mad and threatened to call the police.
and good
And
for you for doing that because there is no ethical world planet anywhere where you can declare brain death under paralytics. That's not medicine. That is murder. That's murder. So let's touch on this really quickly for my listeners who may not understand about a declaration of brain death and why that cannot happen under paralytics. So, if the question of the day, can someone be declared brain dead if they are on a paralytic, which is necessary when you're on a ventilator? The short answer is no, they cannot be. You cannot declare somebody brain dead while they are under the influence of a paralytic agent. These are neuromuscular blockers. And this is a gross violation of medical ethics and just clinical standards. Let's talk about why that is. Paralytics prevent movement. It actually mimics brain death. The paralytic does not affect brain function directly, but it eliminates voluntary muscle activity. So that includes breathing efforts, reflexes, responses to painful stimuli, like you're talking about the stimulator test. So he's not going to respond to that because he is on a paralytic. So that makes it near impossible to accurately assess brain function unless that drug has been fully metabolized and cleared from the body. And I really want to touch on this really quickly, and that is what does the standard protocol look like to determine brain death? And first and foremost is confirmation that all sedatives and all paralytics have been discontinued. So that did not happen, correct?
absolutely, it did not happen. No.
Okay. Second thing is if they have been discontinued, we need to allow sufficient time for those drugs to clear the system. So that clearly didn't happen.
They would let him come off the medication long enough to note it, it looks like, but they never tested him again after the 26th. That's the only test ever done. And then whenever he would respond to us, almost you could say, they would give him more like Valium and Nimbex and
Right. That's what
morphine
we
and
see
fentanyl.
over and over again. And that's why we couldn't get these patients off of ventilators because of the high doses of the paralytics and of the sedatives, the Versed, um the morphine, all of these medications, the fentanyl that were making it near impossible. But the third thing that needs to happen in order to declare brain death is they actually have to do a confirmatory lab test that shows that any of these drugs are cleared from the system and are not suspected to be active. I'm assuming that didn't happen.
That did not happen.
What about a breathing trial? So, a breathing trial is going to be necessary where they are turning off all of the medications and they are going to see if they're going to stop the ventilator and they're going to let the patient breathe on their own to see if the patient still initiates a spontaneous breath off of the ventilator. Did that happen?
Would that be what they refer to as the apnea test?
Yes, correct. That is
Okay.
exactly
So
what it is.
no,
Yeah.
he didn't qualify for that, the record stated.
Okay. That is also something that is necessary in order to declare brain death. They have to go through the apnea test. And then you have to have an absence of all brainstem reflexes. So if there's any paralytic agents that are still present, those can falsely suppress movements, they can mask responses, and it can actually create the illusion of brain death. So if a patient such as Andy is declared brain dead while under active paralytic, that violates just about every acceptable clinical guideline. It raises serious ethical, legal, and criminal implications. And so I'm hoping that you've spoken with an attorney.
No attorney will take the case because
Really?
of the COVID shield. No, the COVID shield, they won't
Because of
even,
the PrEP Act.
Yes, and if they wanted to give me, I guess, some sort of a hope, they would take the records, keep them for 6 months, and then send them back to me and say that he just had too many health issues. But clearly, no, he didn't. I mean, I find myself not even a lawyer, and I could go to court probably tomorrow in front of a jury of people who have been through what I've been through and what he went through and what our family went through, and it would be one day hearing this story, they would get it, and they would know. So no, the hospitals were protected. I
So this
spoke
will
to
fall
numerous
under
attorneys.
the PrEP Act, although we can prove he didn't have COVID, I guess it's just the COVID era, I guess, is going to protect every single medical error that happened during this time because the brain death determination while under paralytics, just to me as a medical professional and as just somebody that just has common sense, to me, that's completely separate from the COVID issue.
Well, there was a lot of things to me completely separate from the COVID because you don't, for one, Andy was not an organ donor. I think that organ donation is a great thing. It saves lives, many lives, but he wasn't one for good reason. Dr. Global it was the neuro doctor that they said they had to come in for a second opinion on his brain. They were going to check him and this and that. That doctor, I found out through the records, it was just a telehealth visit. He did it over a computer screen and talking to the nurses. But when he called me, at first he seemed a little sympathetic. This is just a catastrophic event. Um, but I wasn't listening. Well, I don't care. He's not dead. I don't care. I don't care. And until I can see him or I can get an EEG, that doctor got really aggravated at me. And he goes, look, do you know if he's an organ donor? And I told him he wasn't. And I told him he better not touch him with a 10-foot pole. And I fired that doctor. I don't know if I could have did that, but I did. I told him he was fired. And then come to find out, CODA was contacted 6 different times, the Kentucky Organ Donation Association, 6 different times on Andy. Starting on the 23rd, the 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 lady, Sarah Spicer, which was at his bedside when the Nimbex was administered, she is a representative for CODA. And I found that out in the medical records that she was at his bedside on the 23rd. I found 3 calls to CODA in the records, but when I contacted CODA after he died, I was informed that hospital called them 6 different times on my brother Andy. I don't know what that would have all been about. But then I also, right after he died, received a call from the New York coroner's office. And I missed the call, so I called it back. And the lady, she wasn't real friendly at all. She asked me if we had had a death to COVID. And I said, well, we have had a death because of COVID, but he didn't have COVID. I say that every time when someone asks me. And she said, well, that's probably why they called. And I said, where are you? And she said, this is New York. And I said, I'm in Kentucky. And she really quickly said, sorry, it must have been a wrong number, and then hung up. So to me, that was just really, really weird, despite a lot of other things. But yeah, so at the end of the day, an ethics committee, after that 26th, when I told him I was going to call the police, from around the 23rd, when he was on the vent, I began trying to reach out to his orthopedic doctor because they weren't. And they weren't listening to me about his leg. They wouldn't do a Doppler since surgery. This man has not had a Doppler on his primary, reason for going to the hospital. Demand they do one.
Looking
They
for a
say
blood
no.
clot, maybe,
Yes,
because I was
it was
wondering in
legs.
the beginning if that was not what was contributing
Never.
to his shortness of breath. I mean, it made sense to
Right.
me that the first thing we would look at after that surgery would be a blood clot.
Exactly. And I know that medical science has saved many lives with blood clots and sepsis and all kinds of other things. But we got to where Andy's records started being about opinionated words, believed to be, likely to, suspected of. Um, that that is completely not medical science. I could have gave those opinions and kept him at home and hopefully waited for the roads to clear from the ice and got him to Louisville. Otherwise, if there was no ice on those roads, we would have took him to Louisville. That was I mean, I don't know. They then tried to make us the bad people. They called me inhumane because they wanted to unplug him. And I said, you need to call his ortho doctor. And they acted like they didn't hear me say that. I know that sounds crazy, but that's how it went. Finally, the ortho doctor calls me and he tells me he needs this, and that. I'm going to go up tomorrow. Chances are his body has went into protection mode, he said. Sometimes when they get this infection that he's talking about, he can get rid of the bone, which would be leg amputation. Um, and then Andy would possibly begin to wake up. But he didn't know also all of the different things that they had did, like all the Nimbex and the Valium and the pain medicine. He didn't know about any of this because they had never reached out to him. So I call them immediately and I tell them, okay, the doctor's coming. And this was on the 1st of March. The lady, her name's Cash. She's the captain nurse. She acts like she's listening. I don't think that she really was. But the minute she gets off the phone with me, she goes and schedules an ethics committee meeting. And the ethics committee, from what I'm learning, they changed Andy's status code from 100% full code to a DNR. And when they called to let us know that at 5, oh no, it was about 6 because they did that at 5:34 p.m. that afternoon. We knew nothing about it. When they called to inform us, they didn't call my phone, who they had been calling the whole entire time. They called our dad. And my dad sitting there, and I was telling him, don't listen, Dad. Don't listen. Don't let them get to you. Don't listen, just like that. And he's sitting there. And I swear, I heard him say, well, can they do that? And he was told, yes, they could. He was told numerous times what it meant and how it was going to play out. And he sat there. And I watched his soul basically just leave that moment. And I said, Dad, don't listen to him. So luckily,
Can you remind me and my listeners, how old was your brother?
my brother was 38 when this all happened, and he didn't have a health problem at all, other than he broke his leg at work, and we knew
38,
what the
your
problem
brother
was.
healthy. Yeah.
Yeah, 38. And so, I mean, I don't know how it could get any worse than that. The minute they find out that the doctor's coming, instead of giving me the closure to move on and live on, even if they were right, which would have been an EEG, letting a doctor that I trusted, which would have been Dr. Seligson, arrive, check his leg, those things weren't done. And I would think that if I were in their shoes, and at this point, I have already threatened them with premeditated manslaughter. I would have did everything I could to prove that I was doing nothing wrong. Oh, here's your EEG. Let's do this and that, or let's wait for Dr. Seligson. Let's give her that closure that she needs, because even though he's brain dead, even though he wasn't, she has to live on, and his family has to live on. Let's give them that. Even if we're doing wrong, let's give them that. They wouldn't. And that told me right there something was up. And so, with the recording, I started recording phone calls. And those phone calls tell a lot. I'm glad I did it because I knew Andy wasn't dead. Then I knew that he wasn't going back to work because he was going to be minus a leg. I knew that he had already made me his voice. And I also knew that when he woke up from that sleep and he saw one leg missing, he was going to be mad at me. Really, really mad at me. But I was going to have those recordings for I was going to say, yeah, Andy, but listen to this. You almost died. Thank God you just lost a leg. And then B, because I knew he wasn't going to be able to work and he has 3 kids. He was going to need to support them. And he has a lawsuit, is what was in my head. Because again, we weren't being told as Americans all these protocols on these hour-long Andy Brashear's everyday kind of speeches that he gives. He's not one time telling anybody about these protocols. And then I noticed the ones that didn't go to the hospital lived. The ones that went were dying.
That's the question I have begged people to ask themselves through this whole thing is, I like to just ask thought-provoking questions of people. And I've asked this over and over. If it were the virus killing everybody, then why is it only in the hospital that patients are dying? Patients aren't dying at home. They're not dying in our communities, just in the hospitals. Why is that?
Yeah. It's and also I'll add that Davies County, which is where Owensboro is, on the 23rd, let me jump back to there just real quick. That's an important day. I call that a significant day in the timeline. I got a phone call on that day, and it was from a Twin Lakes Regional Medical Center employee, someone that had been on Andy's medical care staff, whatever you call that. And I answered the phone. I didn't get hello or how are you or how's Andy. I got to get him out of there. And I said, what? And I'm already confused as to what's going on, why they're not finding issues in this leg that I know is the problem. I said, what do you mean? And she says, you got to get him out of there. Something's going on and it's weird. We don't know what it is. We're not allowed to ask. And I said, I don't understand. She said, okay, well, we're not allowed to vent at our hospital. We're told if we even suspect a ventilator to be needed, we are to send them straight to Owensboro, no questions. If we question it, they'll show us where the door is. She said, get him out of there. And so, I tried. I got a transfer set up, but then Dr. Seligson had called me. And when he called me, it was like right in between the calls, and he told me he was coming. So I stopped trying to get him transferred. But they did try to transfer him back on the 1st. It was the 2nd at early morning. They called U of L, Owensboro did, and they made an emergency transfer call for my brother. And 20 minutes later, they called back and they canceled it due to patient was deceased.
That is all the time that we have for today, friends. But remember, we are here on the air 5 days a week, Monday through Friday at 10 a.m. Eastern with a different nurse host daily. You can also catch the encore at 11 p.m. Eastern Standard Time. Please be sure to tune in and listen to myself and these courageous nurses. As we walk you through all of these hot topics, we will empower you with information and education. We will advocate and we will stand in the gap for you because we are nurses and this is what we do. I'm your host, Nurse Kimberly Overton. You can find me here every Wednesday morning at 10 a.m. Eastern. Until next time, be safe, be well, and God bless. Remember, we are in a war for truth. We are putting out a bounty on the real misinformation and exposing the purveyors of propaganda. No topic is off limits as we shine our light and expose the darkness.